Okay, so today we're going to talk about the destructive effects of stress on the human body. I'm Dr. Rutherford, a certified functional medicine practitioner, chiropractor for 35, 36 years now. This is
Dr. Randall Gates, board certified chiropractic neurologist.
and together we
as well.
and together we have kind of morphed or developed a chronic pain practice by observing and applying different principles that we've learned from different mentors that we've had, but as much so, if not more so, from having treated probably several thousand patients now who have chronic pain problems, chronic pain conditions. If you're a patient that has gone to doctors and you have chronic problems, if you have stress, you have chronic problems probably. So I'm assuming that some of you have chronic problems like fibromyalgia or peripheral neuropathy, and if you've gone to doctors about it, a lot of you maybe have been told that you're stressed. It's not entirely true, but it's definitely partly true. And I can't believe we haven't done something on stress
Me either.
at this point in time, because we started doing these about, what, 8 months ago, 7 months ago, something like that.
6, 7 months.
And we've been doing them once a week. And stress it's like the deal breaker,
right,
in these cases. One of the things that we have found to be successful in our practice is to make a good patient selection. Generally, we have a pretty good feel for what chronic pain is and the different factors that are involved. And stress is almost virtually always one of the factors. And Dr. Gates has mentioned that the Zebra book.
Oh yes.
By Rob Sapolsky.
Why Zebras Don't Get Ulcers. A must read for all of you watching out there.
Probably about 15 times. And I actually have thumbed through it and I've accessed different parts of it depending on what I needed to know. Dr. Gates has read the whole book and highly recommends it, as you usually refer to it as the best. Yeah. The best reference for lay people out there on stress, that there is. And zebras do get stressed, by the way. And I was disappointed to find that out the very first page, but he explains why that became the name of the book. So stress is huge. I was just discussing with Dr. Gates when I was a kid, and I can't remember the term. And if somebody's my age, and I'm 61, somebody my age or older remembers that time, we didn't use the term stress. I can't remember what the name of the term was, but stress was developed. The term was adapted or adopted from a physics engineering term that you're probably aware that stress on a beam or stress on a supporting column or stress on a supporting structure is stress. And if you load that beam or that structure too much, eventually it breaks. As I said to Dr. Gates, kind of like our patients.
Yeah.
And so and then we started to use that term. It became a term that I started to hear probably my teens, probably, and it's in the lexicon of our language regularly, probably as much as it should be, because we are a stressed out society. And so stress is understood as like, I feel stressed, my heart's pounding, and so on and so forth, and we're going to get into that extensively. But stress is also more than just simply the mental stress. It's the stresses of a lot of the other things that we have to assess in the patients in our 12-step paradigm that we have to help people to improve or resolve their chronic conditions, and maybe we'll want to touch on various parts of those somewhere along the line. So that's kind of like stress. We're going to talk about stress, how it affects you, how if we can't help a person to get their stress down, they're not going to get a very good response. They're going to get or a limited response, maybe would be a better way of putting it, or they're going to end up needing drugs. And Dr. Gates's methods and that he's been playing with and I won't say playing with, but been utilizing and experimenting with would be better and become very effective, and they're non-drug methods, so that's obviously preferable. So stress, we have a preparatory phase in trying to make this worth your while. And Dr. Gates wanted to start off by saying that stress can be positive. Let's start off with that. And how is stress positive? I mean, let's start off with like people are going out like, yeah, positive. Like it's like killing me. How can it be positive?
Well, we have a stress response to help us to execute an action like fighting a grizzly bear or running from a lion. And in those instances, your body will go into almost a superhuman state. You know, that may not be the right term, but we've talked about it before where, you know, the grandmother lifts the car off the baby.
That's a superhuman state.
Exactly. And basically, the stress hormones in part allow us to do that because it activates our brain to send more signals down to our spinal cord so we can exert a stronger muscular force. We actually mobilize sugar from our liver so that our muscles can contract harder and longer. Our airways open up, our heart beats faster, our blood pressure goes up to get the blood to all the muscles. And so that is the acute effect of stress that can be very, very positive.
So you're referring to something that I find most patients can relate to when I use the term fight-flight response.
Exactly. The fight-flight response. And we can even, you know, go into a situation where somebody's studying for a test, and that heightened awareness because of the stress of the test can help them to perform a little better, as long as it's not too much of a heightened awareness.
Right.
Exactly.
So now we get back to balance. Even with stress, a little bit of stress may be a good thing. And but frankly, that's not what we deal with.
That's not the reality of our clinical situation.
We don't see those patients because those people generally don't become patients because the stress is a little bit overwhelming in the average chronic pain patient, chronic disease, chronic pain patient.
Yeah.
Well, why don't you talk about that? Why don't you talk about that acute? So stress is a mechanism in which you perceive danger, or like a test that you have to pass, or you're an athlete who has to win a game, or you perceive something is going to attack you, and then your brain, your automatic part of your brain, the brain, it's not, stress is not really a thought process. It's kind of an automatic process. Yeah. It's like something that you almost don't control. The thought kind of ends with, oh, there might be danger, and then the body automatically goes into a stress mechanism. The part of the nervous system that deals with this is called the autonomic nervous system. Mm-hmm. So it's easy to remember. It's like the automatic nervous system. It's like automatically puts you in a position to do what you need to do. Hit that baseball farther, catch that football, pass that test, fight that tiger, mm-hmm. or run.
Yeah, exactly.
Or run from that tiger. Yeah. And it puts your body in a position to do that. It causes your eyes to get bigger, causes your heart to pound faster because you're pumping blood out to your extremities, your feet and your arms, so you can run. Sugar goes mm-hmm. to the muscles. Yeah. You kind of get, this area of your body kind of gets drained of everything because you don't need this to fight. You need this to fight or to flee. So that's where the fight-flight mechanism comes in. So you're walking along, everything's fine. You've been meditating. You're just like you're just feeling great. You're very peaceful, and all of a sudden, some tiger comes around the corner, and you find out how very not peaceful you are. Yeah. You know, then the cartoons, they have the hair flying up and all that type of stuff. So that's the stress response, and it's pretty automatic. I saw the tiger, hair went up, you know, blood went to the arms. I'm running from the tiger. Okay, I'm not standing the fight. So there's a lot of So the other thing I think I find that interests patients a lot is, so there's a lot of physiology that goes on with that.
Oh my God.
There's not like this concept that has been understood yet that this changes everything. This changes everything in in
Right.
And that's something I think we'll hit as we go through here. That's kind of a little bit hit acute.
Yeah, and exactly. And basically what a lot of people.
Go ahead. And how about that versus like long-term stress?
And there's this concept of interoception, which is a sense of one's inner functioning, so to speak. And they talk about this a lot in the stress literature because a lot of people have poor interoception. They're not aware of how stressed They really are. They're not aware of the fact that their heart is beating fast or hard. They're not aware that, they're running behind and they got to take the kids, to school before they go to work, and they've had a coffee and they've had a donut, and then next thing they know, they're behind all day long and their boss is yelling at them. They go home and they repeat the same process. And so that kind of dovetails into the chronic effects of stress that so many Americans are in.
How long is that stress response designed to be?
Max about 20 minutes.
20 minutes. So when you get a stress response, it should be in effect for max 20 minutes, okay? And then there's another part of the nervous system that is supposed to calm it down. Right. The vast majority of our patients, it doesn't do that. It doesn't kick in and calm them down. Yeah. And now you're going to talk about that.
Exactly. And so for most of our patients, they are stressed all the time, and they're exerting these reflexes all the time, and the human body is not made to sustain these reflexes. And they really are reflexes, as you alluded to. So as a consequence, we're producing too many stress hormones. So stress hormones can go into our brain, namely, and they can cause us to have deficits in memory. The memory part of the brain gets damaged on a number of levels. Not only do the brain cells in the memory area not work as well, they actually change in their architecture, and other nerve cells associated with brain damage actually come in and increase in number. These are brand new findings from Dr. Sapolsky. Dr. Sapolsky is the world's foremost researcher on stress. He deserves the brunt of the credit in the stress neuroscience world. So that's very interesting unto itself. Also, chronically elevated stress hormones will imbalance the immune system. They will lead to the gastrointestinal tract possibly breaking down. They can be associated with polycystic ovarian syndrome, like we were talking about. Central obesity, meaning obesity around the abdomen. You go to the mall and you see a lot of people have a lot of weight around their waistline, and stress can definitely be associated with that. And those are the major functions that we see chronically. But the problem is that we run into, because we have a neurologic and autoimmune practice, is that a lot of our patients develop autoimmune disorders, and stress is tied into almost every rheumatology textbook, immunology textbook, endocrinology textbook, where they say, yes, we know that stress will lead someone who has a genetic predisposition to developing an autoimmune disorder.
Right. So chronic stress for us, or for the patient that's sitting in front of us, can be a deal breaker if that person doesn't embrace stress, wants to embrace it, but doesn't understand the concepts of it. We have a lot of different programs that we put together for different types of classes of patients that have come into us now that we've been doing it for a long time. But we have one particular program in which, and I'm trying to come up with a better name for it, frankly. We call it our relaxation program, and we might want to talk about that at the end when we talk about strategies. But the bottom line is as Dr. Gates said, for example, I'll take one example that he used. When you're stressed, you put out something called cortisol. Dr. Gates is going to talk at this at more length. Normal cortisol, good. Too much cortisol, bad. One of the many things that stress does is it will continually damage the inside of your intestines. Well, if a person comes in here and they have intestinal problems, and that's part of their chronic stress problem, and we're trying to fix it with diet, and we're trying to fix it with herbs and botanicals and natural antibiotics and real antibiotics and whatever you're trying to fix it with, it's not happening if you have a continual stress mechanism going on 24/7, and that was the other thing I wanted to bring up. Again, most of our patients have this mechanism going 24/7. If you want to know who you are, just think about if you're one of those people whose brain's going 1,000,000 miles an hour and you lay down, you can't go to sleep. And then you wake up in the middle of the night and you can't go back to sleep. There's 2 or 3 things that can be, but stress is probably the #1 probability. And I don't know if I should go into this, but I'm going to, because he may or may disagree with me on this. But blepharospasm. Okay, blepharospasm.
We should call it blepharoflutter.
Well, I'm gonna explain it. I'm gonna explain it.
All right, good.
So we had a real blepharospasm case come in the other day. Blepharospasm was where somebody is always going, because their eyes are going like this, and it's really obvious. Okay, yeah. But blepharoflutter is where when you close your eyes, when I close my eyes, they're quiet. When you close your eyes, you may notice that they go like that. that seems to be an indicator that this mechanism, the stress mechanism, is going on 24/7. So if you're getting that, if you're not falling asleep, then you're probably in this 24/7 stress mechanism, and that is killing you. It's destroying your health, that's for sure. And I was just reading about adrenals, a little bit about adrenals the other day, and that they were saying, well, people can be in this DHEA dump level for a lifetime, and this is what causes it. It's stress. And so ultimately, we're going to talk about the fact that, and it's not, I want to make another point. Dr. Gates said, it is a reflex. So a lot of people come in here, and they have been abused by their, well, now you're talking, all right. Well, a lot of people come in here, I have 24/7, have been abused. Verbally abused, physically abused, sexually abused when they were younger, or perpetually into their adulthood, okay? That will create this type of a mechanism. So I used poor term. What I was going to allude to is they've been told that they're weak. You just got to pull up your bootstraps. You just got to learn to calm down. You just got to learn to calm down. You got to stop worrying about things. This is not the way this is. Okay, this is a physiological abnormality that has kicked in, and it just hasn't stopped. Now your threshold for anger becomes lower. Now your threshold for anxiety becomes lower. Now your threshold to jump on that person who tells you just got to calm down becomes lower. And so these are the things that I think it's important. These are the things I find it's important for our patients to understand before they get into our program, because if they have this 24/7 mechanism, it's got to go. And it can go. That's the whole point. It can go because it's not you. It's not you. It's a physiological mechanism that has been set off by whatever it's been set off by, and it just, nobody's bothered to calm it down other than taking drugs.
Right.
Which is a solution, but a long term, there are better solutions.
And it's so analogous to telling a Parkinson's patient to stop shaking their hand. I mean, that's the thing.
Okay.
Maybe they can stop shaking it for 30 seconds, but then it goes back to that because it's an involuntary problem in the brain, as you perfectly said.
So what's the next? The U curve for stress.
Yeah, and so stress hormones are not all bad, kind of as we've talked about. If we have a normal level of stress hormones, that's a good thing. If we have too little stress hormones, that's actually a bad thing. If we have too many stress hormones, that's also a bad thing on all spectrum of our physiology. All spectrum. So basically, the brain is where a lot of this research has been done. But that's important to note.
So I'll be the straight man here. So is there a difference in the effects of low stress hormones, in this particular case cortisol, versus high stress hormones?
And when it's really low, it's really due to a tumor or a process.
And what is it going on? So the low stress hormones are created by something like that, but the high stress hormones are created by
everything we're talking about.
Everything we're talking about. I mentioned that 12-step program, and we're talking about food allergies, we're talking about infections, inflammation.
Right.
We're talking about the mental stress that is there from this neurological mechanism. We're talking about mitochondrial dysfunction. We're talking about hormonal, everything that's stressing your stress gland, which I don't think we mentioned yet.
I don't think so.
That is also stress. So it's not just this mental stress that's going on that needs to be knocked down. It's that stress plus all of the other things that are affecting that same organ, causing the same abnormal function in the hormones.
Exactly. That's correct. Because a lot of people say, "Well, I was stressed when."
He's the expert. I'm just learning. That's why I'm asking.
Well, we can't say expert, but
okay, he's not the expert. He just has studied this an awful lot and treated an awful lot of patients who've gotten well. So.
But basically, a lot of patients will say, I was stressed, I was abused when I was 10, but I've gotten over that. Well, good on them for having a fantastic outlook on life, and the fact that, in our society that's viewed as being tough and stoic, and, people really don't want to hear other people's problems.
And it's positive to do that.
Yeah, but the problem is that even though a lot of people say they've quote unquote dealt with it, those stressful and horrific experiences that may have happened to someone at a young age lots of times become very, very learned in the brain, especially if they happen before the age of 17 or 18, because at that time our frontal lobes have less ability to dampen or rationalize those horrible, atrocious events.
Well, does it have anything to do with, too, that those atrocious events tremendously stimulate the emotions?
They do.
And then
they can't get shut off because the frontal lobes are the ones that should be able to shut off. And we're not saying that you should be able to shut off something like sexual abuse. I mean, I'm not saying that.
Right.
But it becomes more learned in the brain, and then these fear-based responses now are revving at, let's say, 5,000 RPMs rather than 2,000 RPMs all the time. And these signals are being sent to every aspect of the individual's physiology. And we say every aspect. We have a great diagram in our exam room that basically shows every organ of the body being affected by this autonomic nervous system, which is really the automatic nervous system. Mm-hmm. And so many Americans, and really so many of our patients, are shifted to that fight-flight response most of the time. Right now we have a patient coming in who had a traumatic brain injury, and one interesting thing with brain injuries is that people can have a tendency to going towards this fight-flight response again, and their physiology can change. And that's really why he's seeing us, because of the downstream consequences and a number of things that a lot of us take for granted, like swallowing, and we won't go into the rest of it, get affected. So yeah, that's what I would say.
Yeah, not to be, not to overemphasize this or be ultra repetitive, but we're in a stressed out society. I mean, we're in a society that is stressed 24/7. Cell phones, which I have one in my pocket that I just remembered, I think I forgot to shut off, so hopefully it's not going to ring while we're doing this. Cell phones, you're in contact 24/7. We now have the 2 working member family where, that puts a lot of strain, especially if the family has children. We are eating stressfully. We don't eat anymore. We're in fast food. It's not just the food itself. We eat fast. We go to restaurants and it's like, okay, right. The waitress is like, okay, you're done. Get out of here. Let's get the next one in. You're not supposed to eat fast. We take too many drugs. I mean, there was 4 billion prescriptions written in this country in 2012. 4 billion people. There's only 325 million people in this country, okay? And that 4 billion ended up being 79% of all of the prescription medications written in the world. And painkillers are among the top, and painkillers, a lot of them work by messing up your brain. We stay up late at night. We don't sleep by the natural rhythms that we used to sleep. So as a result, we go to bed late. We watch some of these funny shows. That keeps going in our brain. I should stop probably watching baseball games on my cell phone before I go to bed, because you should not, maybe for an hour and a half before you go to bed, you should be quiet. But we're watching television, and we're eating junk, and we're doing all this stuff, and then we go to bed and we sleep for 5 hours or 6 hours because somebody told us we should be able to make it along lack of sleep. Mm-hmm. That's not to count all of the, again, I go back to all the drugs and the antibiotics. All this stuff has created an incredibly stressful society. And yes, there's been stress in society previous to this, but not anything remotely close to what we're experiencing now. So living without television and electricity wasn't particularly stressful because people didn't know what television and electricity was.
Right. That's a great point.
Yeah.
That's a great point because I don't mean to interrupt you.
No, please.
You go back to the 1300s and people were impoverished and they had famines and they had no vitamins and they died by the time they were 30 because they died of some infectious disease. Right. Well, we're not there anymore. Now we live in this new set of circumstances, and it's the stress is one of the main things that's parasitizing our society. Aside from the food, the way we eat is not only how fast we eat, but the way we eat.
The way we eat, what we eat, too many people, so many people, so we have to produce so many crops, so we have to produce them, and then we have to, put chemicals on them. And is it the GMOs that are causing a lot of problems, or is it the chemicals that are on the GMOs that are a lot of problems? Whatever it is, this is what we see every day, and we kind of delve into every one of those things. So I do, and I apologize. I interrupt a lot. I watched one of these things last week, and I'm like, man. Somebody watching this is probably saying, that guy should shut up and let the other guy who knows what he's talking about talk. But I'm the one who hears kind of like where the patient is when they come in and where they are before they decide they want to get treatment. And I need to kind of figure out, does this person understand enough of what's affecting them to be willing to make the specific lifestyle changes that they're going to need to make? And the answer has to be yes. And if you're watching this and you think everything that we say is crazy, you would not be a good candidate in this office, I can tell you right now. Mm-hmm. But so I think that kind of sets the understanding of stress.
It does, and I want to say one other thing, because I think those in the manipulative sciences, where chiropractors by training have a ton of emphasis in looking at the stress response. Early people in manipulation, whether osteopaths or chiropractors or body workers, looked at how you could adjust or work on a certain area of the spine and maybe cause someone to be more stressed out, or the rest and digest reflexes, which we haven't even talked about, come from the brainstem and really down by the sacrum. So that's why I think this resonates so much with us, and I really feel that we're onto this lifestyle medicine type of paradigm that was proposed by Dr. Bland, who is the father of functional medicine.
Right.
And in lifestyle medicine, we look at simple things like stress, like food, that can drastically affect someone's body. It's approaching the problem from the front side. Nothing to denigrate our medical counterparts. And we say every week we have nothing against medicine, nothing bad to say about medicine. We have many friends who are doctors. We have doctors who work with us on many of these cases. But the thing is, if you've been anxious for 20 years and you haven't addressed it, you've been eating a certain type of diet and you've developed diabetes and you burned out your pancreas, by that time, yeah, you need a medication. Whereas we're trying to go to the front end of the problem and say, how can we prevent this? And that's where it's exciting, because we see just phenomenal changes.
Yeah, stress is a big part of the 120 million chronic pain patients that are out there. Big part, 120 million. Again, I will repeat, there's only 325 million.
That has to be half the adult population.
Exactly. Exactly. There's 325 million people in this country, including kids. So that was Stanford and that was Harvard saying that there's about 120 million people out there now that are chronic pain. And the point I wanted to make is they're coming in here already on anxiety drugs, already on antidepressant drugs, already on
medication.
Let me tell you, a lot of this is stress. A lot of these drugs are stress, and these are the most prescribed drugs that there is, and they're coming in here. They're already on the acute medical model for stress, and it's not working. Okay, it's working for some. I mean, some people come in and go, if I don't get on these meds, but the goal is you could possibly get off of those meds, probably most of the time. So, and is that kind of, did you already kind of cover stress in the brain, or do you
just want to highlight a few things, a few specifics?
Because you had made one comment about the neurons in the brain.
Yeah, I want to go with that a little further, because Dr. Sapolsky brought up the point that if you take an HIV patient or AIDS patient, they get lung infections a lot of the time, and they treat those lung infections with high doses of huge doses of prednisone, which is basically a cortisol or stress hormone derivative, and it tends to calm down inflammation so that they can function better. However, half of those patients approximately will develop dementia in a year, which is astounding. And so that prompted him to look more closely at how stress hormones affect the memory center in the brain. And he has shown basically a host. I think there was one article that's posted to our broadcast today where he discussed, I think it was about 5 problems that actually occur in the brain cells. Not only do they become weak, but they get deranged, and then they tend to have these inflammatory cells that go into the memory center of the brain and change the architecture of it. And we even talked about, in one of our hangouts, I don't know if it was on functional hypercortisolism or if it was on obesity, where we discussed that now stress levels are being associated as a risk factor for dementia and Alzheimer's, because it has such a profound effect on the brain.
Yeah, stress. Inflammation, and stress.
Mm-hmm. Yeah. Exactly.
Yeah, same thing with Alzheimer's. It's not a genetic problem, and stress has a lot to do with it.
And when we say these aren't genetic problems, we're saying they're genetic tendencies, but so much of your environment and what happens in your life involves the epigenetics of the issue.
Right.
Which is where we're
define epigenetics.
Epigenetics means
that word.
It's above the genetics, so it means that someone can have a genetic risk for developing celiac disease, but not develop it.
But the person who does
may have been on antibiotics, may have small intestinal bacterial overgrowth, may have a host of other problems, major stressors that resulted in them having their genes turned on to develop celiac disease.
And that's called epigenetics.
That's called epigenetics. Yeah.
See, I needed to know that.
No, you didn't.
Okay, so how about the infamous adrenal glands?
The infamous adrenal glands.
Everybody comes in. Although this is getting less.
Really?
This is getting less. Okay. It is getting less. This is a kind of I don't want to say a joke, but it was kind of like when I got into this. It was everybody comes in And they go, I went to my doctor. My doctor says you can't fix anything unless you fix your adrenal glands. And we even had a colleague of ours who decided to go into functional medicine, came in as he was going, and he looked in the door, and we were sitting there doing some work. He said, I'm getting into this. Can't fix anything unless you fix the adrenal glands. And there's some truth to that, but it's kind of the wrong target. The adrenal glands, in fact, in our paradigm, the adrenal glands are almost, we have kind of a way we go about treating chronic pain, and it's more or less orderly, and then is specified to that particular patient's needs. So the adrenal glands may be treated down here or over here. Mm-hmm. Occasionally, you'll really start getting on them in the beginning when that stress mechanism is overwhelming. Right. But the bottom line is if you get all this stuff cleaned up, the adrenal glands kind of come back on their own.
Exactly.
So it's kind of like the wrong target. It's like, get all the other stuff fixed up, and the adrenal glands will get better. But talk about the adrenal glands, because it is huge. The adrenal glands are so massive in our health and in controlling our balance of our metabolism. So stress in the adrenal glands.
So basically, the adrenal glands secrete a lot of hormones associated with the stress response. So if you chop off your arm and you're bleeding out, your adrenal glands actually make a lot of hormones, so that you save.
You might want to mention those hormones. I think people.
Okay, like aldosterone is one of the primary ones. However, of course, the adrenal glands are going to make adrenaline, which is composed of epinephrine and norepinephrine, and then the adrenal glands make a lot of cortisol. They do make progesterone. The
adrenal glands make the precursors to all of your male and female hormones. Yeah. Meaning that if you're stressed and you're a female and you're having a lot of female problems,
something to look at.
That might be something to look at, because if you're stressed and you're not making the precursors, in other words, the hormones that need to combine with cholesterol to make your estrogen and progesterone, then guess what? You're going to have a lot of female issues, and hormone replacement therapy is not going to be the answer.
And the adrenal glands, exactly, they make the hormones that are associated with secondary sex characteristics, which can be a good thing, can be a bad thing too. Mm-hmm. And lots of times it can go the other way. So they make DHEA, we talked about that. And so relative to the stress response, what we do is we look at profiles of stress hormone production. And this is just not something that's done in medicine, because and Dr. Sapolsky actually talks about this at great length, because he teaches at Stanford Medical School, and he'll almost say it satirically, how in neurology everybody's so concerned about the spinal cord lesion or this form of muscular dystrophy, but we're ignoring this factor of stress and how it plays into neurology.
It's affecting
and endocrinology. Yeah, it's affecting everybody. And so when we're under stress, like we've talked about, we produce cortisol, we produce adrenaline, we produce aldosterone via a variety of mechanisms, but namely cortisol and adrenaline. And those hormones go throughout the body to exert these actions, as we talked about: increase the strength of the heart pumping, increase blood pressure, get glucose out of the liver. But also the stress hormones can get depleted through time. So we talked about we're supposed to be stressed for 20 minutes, not 20 years. And when you're stressed for 20 years, adrenal glands are not like a muscle. If you stimulate them, they get stronger. Most of the time they get weaker. They can't make enough cortisol through time. And then they have a tendency not to be able to make other hormones like DHEA, like progesterone, which is why a lot of the studies on libido, as an example, talk about sleep patterns and stress. Because when people are not sleeping enough and they're stressed, their libido goes down. Hence, watch TV at night and look for all the advertisements for Viagra and low T and all these different things. It's a big, big issue. So that is something that has to be figured out. And relative to when someone's producing too much cortisol and they're stressed in the early phase of the stress response, that can have enormous implications for things like diabetes. We see it all the time, where someone's blood sugar will be normal all day, but it's really high at a time when their stress hormones are high, because cortisol trumps insulin. Cortisol is the dominant factor. It's more important that you have cortisol so you can survive out in the desert when you're starving than insulin.
Because it mobilizes
the glucose and it will break down muscle so you can get
So a lot of people don't understand how much the adrenal glands have and the cortisol have to do with controlling their blood sugar.
Oh my gosh. And so many of our patients who do have adrenal problems will start them into our extremely strict nutritional modification program. And
it works though.
It works great, but lots of times, because it's less reliant on processed carbohydrates, then they'll crash because their adrenal glands can't even sustain their blood sugar for 4 hours.
Right.
We're meant to be able to,
because they're so fatigued by the time they get in here, and their adrenal glands can't do their job.
As they were talking about at the most recent conference we went to, you should be able to fast for 17 hours and be just fine, not have any symptoms. So anyways, those are the adrenal glands, and then as we get fatigued, we get into those symptoms. And a lot of our patients who have adrenal fatigue feel fatigued, but that can be due to a variety of problems. And you may want to reference the broadcast, Adrenals, the Wrong Target, because in that broadcast we talk about how the new data is showing that intracellular infections, bacteria and viruses can parasitize our ability to make energy, and therefore that combined with the adrenal glands trying to compensate for that mechanism, as well as the person being under stress, then the adrenals just crap out for all intents and purposes.
Right. Yeah. So if you have chronic fatigue, okay, and you're still on the Epstein-Barr virus thing, you look into this, because chronic fatigue is going to be a combination of thyroid, blood sugar, adrenals, and gut problems. That's what it's going to be. And the adrenals, stress. And again, more than anything, I think we treat, if stress isn't handled in a physiological way, and most of the time it can be done in a non-drug way, it's a deal breaker for the person who is in chronic pain. And I think that's the next thing that Dr. Gates wants to talk about, is how these stress mechanisms result in the chronic pain of virtually almost every single type of chronic condition that exists.
Yeah, and the literature is just overflowing with this data. Yet still, I find articles in the journal, I think it was Neurology, Neurosurgery, and Psychiatry, where they were talking about functional neurologic syndromes, basically conversion disorder, and they classify chronic pain into that. And it's a travesty in my opinion.
You might want to define that.
Conversion disorder is basically saying the person is faking it, or it's not really a real entity. Maybe they really believe it. It's basically implying that there's no real process that's causing them to have.
It's in your head or you're faking it.
Right.
That's what they're saying.
However, when one looks at the literature on chronic pain and stress hormones, it's overflowing, stating that basically the elevated adrenaline binds to the back half of the spinal cord, causes increased pain nerve transmission is the best way to say it. There's a lot more nuances to it, but it basically is like fuel on the fire for your pain nerves, stress hormones. And then also the new data relative to half of fibromyalgia patients. Fibromyalgia is where the person has pain all over their body and they don't have rheumatoid arthritis or lupus.
Very sensitive
to their skin.
Yeah.
And those patients, in essence, have, I lost my train of thought on that.
If you're out there and you're fibromyalgia, he was talking about.
Small fiber neuropathy. So they're showing that a lot of those patients, because of the stress hormones, their nerves that transmit pain actually start to degenerate. And they develop small fiber neuropathy, which is a peripheral nerve condition. Half of them.
So you'll have numbness, tingling, burning, something like that in your feet, and maybe your hands, for those of you who are not maybe conversant with the term peripheral neuropathy.
Mm-hmm.
Yeah.
Exactly.
Yeah, and every fibromyalgia patient who's ever come in here, I'll tell you what that is, because some of you may be watching may have fibromyalgia. Why? Because this fight-flight mechanism that never shuts down I can't almost ever think of a fibromyalgia patient who hasn't had it, that has come in here.
Yeah.
And we think it's part of the fibromyalgia picture. And so, again, you can go back and look in the mirror yourself. Close your eyes and see if your eyes go like that. Do you follow that pattern of I go to sleep? And I don't go to sleep. I'm sitting there, my brain's going, finally, I'm exhausted. I go to sleep, and I wake up in the middle of the night. And that's your adrenaline kicking in the middle of the night. And then you wake up like this, and then your brain's going like that again, and then you can't go back to sleep. Now you get sleep deprived, and all the chemicals that goes. But if that describes you, you have this mechanism going 24 hours a day. And it's, I said earlier, it's killing you. Maybe that's too harsh of a word, but it is definitely gradually wearing you down.
Well, I think it's a great word, because even the documentary where they profiled Dr. Sapolsky was on National Geographic, where they called it Stress Portrait of a Killer. And some of our patients will actually break down when I say, go watch that documentary. But they basically showed in that film that those in I think it was the English Civil Service, those at the top of the totem pole in terms of the hierarchy, like the CEOs, had far fewer health consequences than those at the lowest end of the totem pole, because they were under stress, they were being micromanaged, they had to take 3 months off of work because they had, you know, XYZ health problems.
Yeah.
And it has been shown to cause negative effects. Little baboons develop heart disease when they're getting beat up all day. And these little baboons are not eating Big Macs.
Yeah. Well, again, there are a lot of sources.
I don't want to insinuate Big Macs is causing heart attacks, but you know what I mean. Let's just say hamburgers.
Okay.
Yeah.
That's funny. So I think we've made a point relative to stress. It's an issue. It's a big issue in the chronic pain field. It's a big issue in the chronic syndrome. In other words, people who have chronic syndromes. Anything that you have that's chronic, that's not going away with medication and so on and so forth, stress is probably playing a factor. Now, we've mentioned several times that there are medications, and there's some of the biggest medications out there for pain relief but also for depression and anxiety and other stress-related symptoms. But there are a lot of natural strategies out there. Now, people are familiar with today. For some reason, lately, I have a lot of people who are coming in who have started to meditate. This has been a new development anyway in my world, although I've been conversant with meditation probably for the last 40 years. So I've kind of been a little bit aware of it, but all of a sudden people are coming in, I meditate, I do this. Problem is, meditation's hard for this type of an individual because your brain's going a million miles an hour, and so to sit down and to meditate, and then if you fail, you kind of feel like, I'm no argument, those of you who are meditating, it's probably the number one thing you can do. There's a lot of misconceptions about meditation there. I know it can cross religious lines sometimes, and so I kind of avoid it in here. But it's a great strategy for those of you who want to use that. But there are a lot of other natural strategies that Dr. Gates has been using in trials. Clinical trials would be a better way of putting it than experimentation or whatever. And it's finding to be very effective. So I think it would be really good if at this point he shared some of those with you.
Yeah, and this is where we have to credit Dr. Carrick, because he came up with a lot of these strategies. Dr. Carrick invented the field of functional neurology and established the training program for those of us in chiropractic to become board certified chiropractic neurologists and certified to a high level, so to speak, relative to other medical
And there's only,
professions.
what, 300-400?
Something like that. Changes every year. But
Chiropractic neurologists. It's a difficult course. Dr. Carrick is a brilliant man. All of these exercises, or if you go around now and you look on television or you look here or you go to physical therapists and they're showing you these brain exercises, it kind of came from a lot of his work. I think he started in like 1979 or something like that.
About the time.
And so with Dr. Gates and Dr. Gates studied with Dr. Carrick, so he's going to share some of these things with you. I can tell you they are. I'll tell you how important this is. We were following this 12-point protocol that we have, or diagnostic protocol, differential diagnostic protocol, I guess you would say. So there's like 12 major categories that we look at, and again, we developed that by studying a lot of people who had already been in the field, and we were getting pretty good results. But when we put specific attention on reducing that patient's stress while they're in the office and during their treatment, it significantly improved our immediate and long-term results, because as that person's stress levels went down, their chemistry also became much more responsive to the types of treatments we were doing, because it wasn't interfering as much with too much cortisol and all these different types of stuff, wasn't interfering as much with the types of dietary changes and herbal and botanical and all these types of things that were being done. And then by the time that person got to the point where all of these other stresses had been taken off of them, and then you introduced these fairly straightforward and simple procedures, we started going from treating people 2 years to now maybe 4.5 months or something. I mean, it made that big of a difference. And so I think, and I'm making that whole point to say some of these are going to sound very simplistic. We've strived to make it as clean and simple as possible so that people will comply once they're out of here. Maybe we've made it look too simple sometimes, I think, but I think people like that complexity equals success. But that's not true. Simple is powerful. And so listen to these with an open mind and understand that Dr. Gates developed these relative to taking Dr. Carrick's work, relative to our clinical responses here, and these are effective. So take note.
So basically, light and sound are intimately tied with the stress response, and the fear-based responses it's called the amygdala, that ties in primarily to the right frontal lobe to cause these stress reflexes that we've talked about now for an entire hour. And basically, if you can, in our experience clinically, and we've seen it to be pretty powerful, to say the least, if you can change the input of light or sound into the brain, and maybe even specifically into one side of the brain, we see commonly that the stress responses can really, really come down. We also use techniques where we try to increase the activity of the lower brainstem, because the lower brainstem sends signals up to the upper brainstem where the stress response comes from, right behind the eyes, and shuts it off. And so we use strategies such as that. We also use certain types.
Specifically, like we use different color glasses.
Yeah, we use different colored glasses.
Like we might use red glasses. We might use blue glasses, green glasses.
Red glasses on the left, blue glasses on the right.
Exactly.
For the hemifield, so it looks like John Lennon glasses with blue.
Yeah.
Red over here and blue over here.
The success to that is to be able to determine and understand the mechanism that's involved. As Dr. Gates is his field. And that's what he does, and once you can, so the sophistication, for those of you who need complexity and sophistication, is in his having to be stressed over figuring out exactly what your mechanism is, and then once he goes through all the stress of figuring out what your mechanism is and hands you these red glasses and you put them on, you go, this is it, I came in here for this, and it's like, yeah, put them on, and people put them on, and it can be very powerful. We had one gal who worked with rose-colored glasses, and she went and got a pair of expensive rose-colored prescription glasses because she was like to dress nice and all that type of stuff. And it was stunning because the stress was breaking that case. She wasn't getting over that stress response.
I mean, talking about the downstream consequences, we had one patient who came in who couldn't urinate. She had a severe pain syndrome. Basically, her body had shut down in many instances, and we put red glasses on her for 30 minutes, and the next thing we know, she says, well, I just urinated for the first time in 2 months.
Because it relaxed that stress mechanism, which relaxed a bladder mechanism in the urethra.
Right, exactly.
Yeah,
exactly.
And then she was able to, so for those of you who have chronic urinary tract infections,
right,
and you're stressed, guess what? 26 rounds of antibiotics probably isn't the answer.
Exactly, because lots of times the bladder isn't emptying fully.
Yeah.
Not to say fully catheter, but it's not emptying
other
completely.
Things. Okay.
So then we also use certain types of breathing exercises associated with foot movements. So the feet are right next to the brain, next to the stress representation of the brain. I need my blood sugar up. But basically,
yoga teachers have their feet right next to them when they're doing that back one.
There we go. So there's a map of our body in the brain. There's a map of our visual world in the brain. There's a map of many things in the brain, sound. And so the feet, in terms of their representation, are right next to where the stress part of the brain, in terms of the limbic system, originates from. So if you may have observed when someone's under stress, maybe they shake a leg. Well, they're doing that involuntarily to dissipate the stress response. And so we use certain types of foot movements with a breathing exercise at the same time, which has just worked wonders for a lot of our very stressful or stressed out patients. And those are the things we use sometimes. Right,
because there's 100 different things that you can do. But you really need to find out what's best for that patient.
And we have figured out what works best for our population of patients, too, through trial and error.
Right.
And then also the complexity that goes into figuring out really what type of exercise you need to do and really what is going on is where a lot of practitioners deviate from addressing this issue because it's hard. And that's one thing that drives Dr. Carrick crazy, because everybody is ready to give somebody a supplement to fix their gut, to kill bacteria, to calm down the stress response, when in actuality we can change the brain and basically bring more balance to the autonomic nervous system. Because remember, most of you sitting out there far too much fight or flight rather than rest and digest.
Yeah. Yeah. And there are a lot more things. I mean, there's 100 things that you can use, but I wanted Dr. Gates to just share some of the combination of, like, almost more simpler in application and yet maximally effective. But again, to do that, you really have to understand the functioning of the brain and how to stimulate or calm certain areas or certain parts of the brain that if you strengthen them, they'll help to calm that down. That may or may not be your problem. The only way you're going to know is maybe to get somebody like Dr. Gates, our functional chiropractic functional neurologist, board certified chiropractic functional neurologist, I might add, because you can take one of the courses but not pass the test.
Oh yeah,
and the test is hard.
A lot of people have taken the courses, passing the test.
The test is hard. And so you got to know your stuff to pass the test. And then, frankly, not that many people are coming out and doing what you're doing, but now it sounds like I'm getting in a sales pitch, so I don't want to do that. Okay, the bottom line is, but what I'm trying to say is it's one of our challenges with those of you coming here with a lot of stress. It's one of our challenges in a lot of ways in that people have, you've had stress, you've had it your whole life, you've been molested, you've been verbally abused, you've been physically beaten, you're all this, and you've taken the drugs and you've done all this other stuff, and you're still having all this problem, and then you come in here and Dr. Gates does like the most comprehensive, neurological exam on the planet and says, here, put these red glasses on. You get what I'm saying? It's like, and you're going like, and everybody that we ask concedes eventually that when I first came in here, I thought, you're kidding. And then eventually, as they saw that it worked, they would buy in more and then do it better and so on and so forth. And we're trying to figure out ways to get people to help understand that even though you've been through what you've been through and you've taken the meds and you're doing all this type of stuff and you come into an office like this and we go, well, you got fibromyalgia, peripheral neuropathy, chronic fatigue. Guess what? Your eyes are fluttering, your blepharopathy flutter. Yeah. I call it blepharospasm incorrectly because I'm not a board certified chiropractic neurologist. And then, the person comes in and you find out they're in stress and then after being through all that, saying, okay, we're going to hand you these red glasses, or we're going to have you go home and we're going to have you do this or whatever because this is showing that's the part of your brain that's right next to the part of your brain that controls your feet. And in your particular case, that's the part that's being affected. It's going to calm it down. And the person goes, right, this is going to work, and it works. So this is a new world in stress management. It's pretty cool. Yoga is good stress management. It's more general. Acupuncture is good stress management. It's more general. Massage is tremendous stress management. It's more general. Infrared saunas are good stress management. It's more general. When you start going to them or you're taking drugs and it's not enough, this could be a possible answer for you, something along these lines, and I would investigate that. So I think that we have investigated stress.
I think we did.
I think we've covered it. I hope you have a better understanding of stress, the things that I wanted to have come out based on what I understand that our patients don't understand about stress. We thought we would share with you and maybe try to convince you that maybe if you're on long-term drug use, Freudian slip there. I'm not anti-medicine, but if you don't know anything else about stress and you're going to be de-stressed and you're taking medication, there's probably a trade-off there that's worthwhile. But long-term, it has significant effects on your brain and your nervous system and other parts of your physiology, your liver, and so on and so forth. So we wanted you to know that there are other ways, but also just to be comfortable and know you're not weak. A lot of what you're dealing with are reflexes. A lot of what you're dealing with are physiological abnormalities, not personality disorders. And I think that's really the biggest thing that I always want to get to a person. And one last thing, I'll just say, it just happened yesterday. I got in here yesterday. Boy, this poor gal, and she's going through it. And she has fibromyalgia. In doing her history, it sounds like she has a bad case of fibromyalgia. She got some sort of viral infection. I briefly introduced her. She got a viral infection in January, and now she's been in continual chronic problem since then. Okay, most fibromyalgia patients, if you're fibromyalgia, they'll have good days, bad days. No more good days for her, it's just bad. And she was sitting there and she was sobbing, and we took her history and so on and so forth. And at the end, I was able to very confidently say, listen, we can help you. You can be helped. How much, we'll find out once we do the exam, the history, but you can be helped. From the time we left my desk and walked up to the front office, she looked like 3 or 4 years younger, because she was walking around thinking, what? I'm never going to get better. Where am I going to be in 3 years from now? I have 2 kids. Am I going to be an invalid? What's going on? Nobody can figure it out, blah, blah, blah. How much stress does that cause? And just the concept that there is probably an answer. Her stress levels went like that. I'm talking like 3 minutes here from my desk up to that front office, and she looked like a totally different human being. That is the effects of stress on physiology. And so I'll leave you with that. And I hope this was helpful. And if you have any questions on anything that you think we didn't cover, that you'd like to know more, Dr. Gates would be happy to answer those questions. and
you send them to our Facebook page. That's where I
send them to our Facebook page.
Or powerhealthtalk.com. I think those get to me as well.
Powerhealthtalk.com. So until next time, we'll try to come up with another interesting subject that hopefully will be helpful.
Thank you for watching.
Okay.